of families in Reno County are living in poverty. That's about the statewide average. It's higher in neighboring Rice, and it's higher when you drill down into Hutch. You also have charts, and I can click on any of these legends and I can remove that particular line. So if I remove the state of Kansas, I can start to see how Reno compares with Hutch, compares with Rice when it comes to families living in poverty over time, which is interesting because here's your percentage, but here's your raw numbers, right? Which percentages and raw numbers tell a different story. These dotted lines out to the side are a little bit of a run out and can tell you, so for example, this is a projection out to 2031, what we think the families living in poverty over time will look like in that particular county. I can minimize and maximize any of these things. So if you're like, where is that data set? It's likely that it's just minimized. Another thing I wanted to point out is when we have it, when the data is publicly available, there is a map feature, which is really nice when you have, particularly in Kansas, when we have some counties like Reno, where there's an urban area, I use that term loosely for Hutch, and then there's a surrounding more rural part of the county. And you can actually start to drill down into seeing, okay, I would expect perhaps more families to be living in poverty inside Hutch versus the county in general. And this can actually kind of clarify what that looks like and where there are needs. I bring this up because it's really interesting to compare families living in poverty map to the map of families utilizing SNAP benefits. You would think that these would be highly correlated, and you see some differences in accessibility and utilizing SNAP benefits. So different indicators. I'm going to go through one other thing because I know I'm at time. I wanted to point out the specific data set that is, again, graciously generated by our partners at Child Care Aware of Kansas. So this is your desired childcare capacity compared to potential demand. This comes from their WLS data. I will just note that this is data that has to be updated manually. And so you'll want to really look and see the date that this is pulled from. And if you want something more recent, definitely go to the Child Care Aware of Kansas website, go to their point in time tool and click on that, because that I know is more frequently updated because it generates automatically out of WLS. So this is the only data set that is not publicly available and is not going to be as dynamic and live as the rest of them are. So finally, the other resources tab here has exactly that, other resources. If you want to dive deeper into information, very key partners who do really good work to help us improve these indicators and make life a little bit better for Kansans. So that's what I have. And I hope that you will find it helpful to you as you are telling your story to community partners and thinking about where you can invest services for families. Thanks, Cornelia.
Perfect, perfect. I see, Martis, do you have questions for Sarah?
No, I had a clap. I was clapping.
Okay, you were clapping. Okay, perfect. Does anybody have any questions? Sorry. Questions, comments at all? Yes, Brenda.
Silly question time. Maybe at a future meeting, or somebody can email me later and explain the difference between Megan's dashboard and Sarah's dashboard. Because I heard dashboard and my brain automatically went, what? So I'm sure there's a simple explanation, but I just need some clarity. Thank you.
I'm sure that's a question that others might have too. So I'd be happy to put that together and send that out so that the whole panel has that information.
Perfect. Any other questions?
This is Emily Barnes. And my question, like when we were looking at the childcare access, I didn't fully understand, like when you're looking at the, like 1 through 3 and 5 through whatever, is that all types of environments, centers, preschools, homes, or can you get more specific? Like if someone is looking at like how much access do we have to center care versus how much access do we have to in-home care in an area? Like, can we get, I don't think I caught that element.
That's a great question, Emily. No, this dashboard does not have that level of granularity. So for that, distinction between facility types, I would absolutely go to the childcare where point in time for that information. And I also know we've got license exempt, and we've got, you know, other places that might not actually convey the full picture. So definitely a limitation of the data.
But if you're looking at like those, the gradation of the numbers of how many, that is however many we know about, all
That's right.
inclusive.
That's right.
in that total.
That's right. Yep. The data set specifically is about the capacity versus demand. So the gradation and the shading will tell you where is there a county where the capacity is meeting demand or closer to meeting demand, and where is there counties where it's not even close, right? And there are some counties where it's 40% is meeting the demand, which is, you know, meaning that there are a lot of kiddos and families without childcare.
Any other questions? Okay, if there's none, Sarah, thank you so much for sharing this. I'm looking forward to kind of going through it and seeing what I can pull from it. Just to think it's always great to kind of see where we are in our community, and so that's great. So thank you for all of the work in this. Lindsay?
Just wanted to make a quick note that we had an interruption in the live stream while Sarah was doing the live walkthrough. So apologies about that, but it's up and running now. Luckily, Sarah did an amazing walkthrough during the All In for Kansas Kids monthly webinar. So we'll share a link to that and make sure that everyone can go back and watch that if needed. So hopefully we're all good now, but just wanted to note that in case anyone is watching, if you missed that interruption, there's great content available and we'll make sure and share it out.
Perfect. Okay, thank you. So next we are going to get updates, reports from our tactic work groups. And so in our last meeting, we kind of talked about the 4 different work groups that we'll have, you know, this year for our panel. And the work groups met after our meeting, and then some met after as well. And so there is a person identified in each group who is been volunteered or voluntold to be the spokesperson, you know, and so with that, can we hear first from strategy 4.2 on family-friendly workplaces?
Yes, thank you, Cornelia. That would be me. I'm Brenda Bandy with the Kansas Breastfeeding Coalition and First 1000 Days. And so our work group has met twice, and I'm just going to share with you what we've been doing. So first, we reviewed the resources that several of our work group brought together. So we looked at the organizations and agency list that was provided to us. We've also looked at some of the groups in Kansas that are working on this, such as Kansas Power of the Positive. And we have a new initiative that First 1000 Days is working on called Family Forward Kansas. And we are looking at, that is an education program for employers, specifically around 4 policies: paid family leave, childcare access, flexible scheduling, and accommodations for pregnant and breastfeeding employees. So we've been spending a lot of time just discussing who is working in this area and how these different initiatives align. And then we have also looked at 4.2.1, which is identifying those resources. That's what we've done. I'm looking through our list here now. Partnering with employers was also the other one. And we have looked at what organizations are doing. Kansas Power of the Positive has been working with employers. So has the Kansas Breastfeeding Coalition, in addition to Childcare Aware and Work Well Kansas. So these were some groups that we've identified that already have connections with employers. And then lastly, we're looking at building the conditions that lead to safety, stability, and nurturing. And it again circles back to those groups that are currently working on that, specifically Kansas Power of the Positive and the new Family Forward Workplaces initiative. So we are going to meet again on May 17th, and we'll be prepared to have recommendations at the June meeting. That's all.
Perfect.
Questions?
Questions or comments for Brenda? No, well, it sounds like you've been active already, and so that is amazing. You know, it's kind of interesting when we hear about the when we just had the conversation about well-being, and one of the things we talked about is the workplace, and the employer sometimes being you know, the entity that maybe can harm well-being unintentionally. And so so this is kind of good timing with all of this coming together, and talking about how we can help our workplaces become more family friendly, and how do we promote that. So so well done. So now we have an update from Tactic Group 6.6, which is compensation and benefits.
Hey y'all, it's Logan Fencing here. And so I, have been helping facilitate, and we had a meeting after our last early childhood recommendations panel meeting, where we have a Miro board created, where really a lot of the questions were guided by the what was outlined in the recommendations for, for what informed the recommendations. Or like we're trying to figure out, a description of the council's committees, groups that are already doing this work. What are folks working on currently in Kansas related to compensation and benefits, seeing what kind of models are out there, as well as reviewing a lot of the resources about what's happening at the national level. So I feel like our group, and folks feel free to hop in, of, we're in this kind of a state of trying to assess the landscape and see what models are of interest to us to kind of pursue and to, I think, dig deeper into, and also thinking about for kind of the long-term professional development and career pathway for providers, instead of maybe thinking about what are maybe more short-term fixes. So yeah, that's, I think, pretty much where we're at still. And I think as soon as we are able to convene as a broader group after we've all looked at the resources and all share what are some of the most maybe cutting edge or what we think could be impactful, it would be great to throw that out to the rest of the group just to get y'all's insights as well, as to help us narrow down, because I think there are a lot of options, especially when you think of a big bubble like compensation and benefits. So yeah, that's, I think, where we're at currently.
Thank you, Logan. Any questions for Logan? See some thumbs up to you, so that's good. All right, Tactic Group 6.1.5. This is on recruitment and retention.
Okay, so that's me. I'm Amy Gottschammer. So, of course, when it comes to recruitment and retention of the workforce, everybody thinks about compensation, which was not our charge. So we were trying to think, how are we going to do that without paying them more, or and maybe in addition to, with any luck. Excuse me. So we are pretty much at the point where we are just still going through all of the resources. A lot of things have sort of risen to the top. We're maybe 2/3 of the way through the resources, but we have come up with basically ways to attract. We're looking at ways of changing public perception, ways to grow our own within our own programs already, public awareness and outreach campaigns, sort of media education through media, things like that. And then working with the community colleges, CTE, looking for ways to create a professional feeling as a value-added benefit, making them feel more than just glorified babysitters, right? How do we get everybody to understand, not just the society at large, but the professional or the providers themselves, that you are professionals and this is something you want to be a part of. So that was another thing that we talked about. Another thing that rose to the top that might help speak towards not only recruitment, but retention, and maybe specifically retention, was mental health supports. That might help keep them on board a little bit longer, maybe looking at ways to create a mental health toolkit for providers and directors, something like that we might be able to work on. We really haven't focused on specifics yet, just a couple of different ideas that maybe rose to the top. We're still looking at resources. We did not get an opportunity to do an additional meeting yet between this one and last, so I'm hoping to get another one in between this one and our next recommendations panel. So that's about where we are right now, I guess. So did I leave anything out, anybody in my group? Any questions?
Okay, thank you, Amy. And then last, tactic group 7.1.2, looking at local zoning.
So that would be me, Aldana Chestnut, and we have also met twice. Excuse me, first we kind of, similar to what Brenda said, kind of reviewed what work is already going on out there and looked at the information that has been collected regarding city zoning with both from what childcare licensing requested of childcare surveyors across the state, as well as what the GO team has been trying to pull up by reviewing the websites of the various cities and counties. So that is already in a working spreadsheet. And so we kind of talked about what to do with that. And then we talked about the importance of working with other groups. And so I had actually done some research and was working with planning, you know, because you've got to work with your city planners and everything when you're looking at these, at the buildings and what's happening, et cetera. So city planning really has impact or input into the city regulations for local zoning, and not necessarily as much as homeowner associations. So we've kind of focused more on the city state zoning versus a homeowners association so far. But kind of looking at the possibility of working with a local, like the American Planning Association. They have a Kansas chapter. So possibly working with them to help to impact or influence some of the local zoning. And we have looked at some other resources across the state to see what our thought is, that we know what we've found from what surveyors are aware of. We know what's been found as far as the websites of what the city's saying. So another thought that's kind of formulating is to do a survey that would go out to childcare providers, home centers, preschools, Mother's Day out, to know what either they are aware of that hasn't already been identified, or if they're, maybe help to identify some misinformation. If providers are going, well, I'm required to do this, and it not really, maybe not be the actual cause.